Hello, everyone. Thanks for tuning in today to my Medicare 101 class. My name is Chaz Mulheron with My Medicare Hotline, and you can see right here getting started with Medicare. And you can check out my website anytime at www.mymedicarehotline.com. And today we're going to be going over the basics of Medicare. I want to make sure you know everything about Medicare. You can see I'm a Medicare guru. I started doing this in February of 2009. Now it's been over 11 years now, and I cover all of Florida. I am contracted and licensed in other states as well, but my main home is here in Orlando, Florida, and I work all around everywhere. Okay, let's get started today. So today I want to go over, these are the parts we're going over today for Medicare. Your Part A, your Part B, Part C, Part D, Medicare supplement plans, your enrollment penalties and delaying Medicare. Maybe you're still working, you're not sure what to do yet for Medicare. I'm going to give you some facts about Medicare. A lot of times when I sit down with people, people have the same kind of questions, so I figured I'd put that here. Like one, Medicare is not free. There is monthly premiums. We'll go into a little bit of what Medicare costs. Also, Medicare is not the same as Medicaid. Medicaid is for people with limited income. It varies state by state. Medicare is for people, maybe you're starting Medicare soon at age 65, but Medicare is typically for people that are 65 and older. You cannot be denied Medicare because of your health. Doesn't matter what you have right now. If you have cancer, you're healthy, any kind of health conditions, they cannot decline your Medicare start date. And you may be penalized if you don't take Medicare when you're first eligible. Some people are, maybe you're still working. We'll get in that in a little bit if you're still working, in penalties. And Medicare premiums are generally automatically deducted from your Social Security check. And typically Medicare does not cover you while you're out of the US. Okay? Who's eligible for Medicare? People age 65 years and older. You might say, well, man, I have a friend who's not 65 years old and he or she's on Medicare. Well, they might have a disability. You can start Medicare early if you have a disability. And then people of any age that is diagnosed with end-stage renal disease or ALS. And in order to get Medicare, you must be a legal resident of the U.S. for at least 5 years in a row. Okay, maybe you're starting Medicare soon. You want to know how to enroll into Medicare. Well, first question I would ask is, are you collecting Social Security? If you are, enrollment into Medicare is usually automatic. You'll probably get your card about 3 to 3.5 months before turning 65. If you're not collecting Social Security, I would highly suggest creating an account at www.ssa.gov. This is Social Security's website. Make sure you go to .gov. But if you create an account there, then you can actually enroll in Medicare Part A and Part B right from the website. Otherwise, you'll have to call your local Social Security office, and then you're going to want to schedule an appointment to go in, but you will have to wait in line and everything. So it does take a lot more time to do it that way, but it is an option. Okay, let's go over the first part of Medicare. This is original Medicare, your Part A. First thing I put there is there's no monthly premium, but I have a star asterisk next to there because there's no monthly premium assuming you've paid into Medicare or married to somebody who paid into Medicare for at least 10 years. So as long as you paid into Medicare for 10 years or married to somebody else has, then Part A will have no monthly premium. And typically it will start on the first day of your birth month, unless you're born on the 1st. So if you are born, say, June 10th, your Medicare Part A and Part B will start on June 1st. But if you're born on June 1st, your Medicare will actually start a month early, on May 1st. So it always starts on the first day of your birth month, unless you're born on the 1st, then it starts a month early. Okay, so we know what Part A. Part A is your hospitalization. You guys will get your Medicare card. It'll say Part A hospital on there. It'll have your effective date. Well, Part A only pays if you're an inpatient in the hospital. If you're not an inpatient, let's say you go to the emergency room or urgent care, Part A is not working. This is only if you're an inpatient in the hospital. Well, you can see right there, days 1 through 60, if you're an inpatient in the hospital, you will owe a $1,408 deductible for 2020, this year, 2020. Now, you could be in the hospital for 1 day, 3 days, 5 days, doesn't matter, all the way up to 60 days, and that's your deductible. It's not like what we're used to right now, though, with insurance before Medicare. You can pay that multiple times per year, because if you're in there, let's say, for 3 days, and the clock's still ticking up to 60 days, you can go back in the hospital in that 60-day window. But if you go out of the hospital and you're home for 3 months later, well, guess what? You go back in, you start back on day 1 again, and you can pay that $1,408 deductible again and again and again. Now, the rest of these numbers here are not that common. So if you were to stay days 61 through 90 in the hospital, very uncommon, but you would have to pay $352 per day. Days 91 through 150, you would owe $704 per day. And those days, those 91 through 150, you only get those once per lifetime. Once they're used up, they are gone forever. After that, Medicare does not pay anything. Days 1 through 90, you always get over and over again, as long as you pay your deductible and copay. So let's say you're in the hospital for a few days and you're ready to get out of the hospital, but not ready to go home yet. The hospital might put you in something called skilled nursing care or inpatient rehab. The first 20 days, days 1 through 20, Medicare will cover 100% of that. You will pay zero. Days 21 through 100, though, you will pay $170.50 per day. Anything past 100 days, you will pay 100%. Medicare does not cover long-term care. Covers short-term care. Medicare does not cover long-term care. You can see right there. All right, so we know Part A is your hospitalization. Now, what is Part B? Part B is your medical. For 2020, the monthly premium is $144.60. That is assuming that if you're single, making less than $84,000 a year, or if you're married, making less than $168,000. If you make more than $84,000 as a single person or married at $168,000, you can pay more for Medicare. Part B covers your primary doctors, specialists, lab work, emergency room, urgent care, MRIs, outpatient surgery. Anything that is outpatient is going to be covered under Part B. Even some injections you might get from your doctor's office could be covered under Part B as well. Part B as in boy. And for 2020, there's a deductible that's paid once per year. This year, the deductible is $198. Once you've paid that deductible, then Medicare will pay 80%, and you are responsible for 20%. There is no cap on how much your 20% can be. Meaning, if you were to go to the emergency room and you had a $10,000 bill, well, assuming you've already met your $198 deductible, you're going to pay 20% of that medical bill. So you would pay $2,000. If that were to happen over and over and over again, you would keep on spending $2,000. There's no limit on how much your 20% is. It could be infinite. The last thing there, excess charge of 15%. This is not very common. And here in Florida, the only place that I know that will charge an excess charge of 15% is a place in Jacksonville called Mayo Clinic. They will take your Medicare card. You can go in there and get services done, but they will tell you right there they charge 15% above what Medicare approves. So be careful if you go to Mayo Clinic. If a place ever says we do not accept assignment to Medicare, we have excess charges, you can expect to pay that extra 15%. But again, it is not that common at all. Okay, so now we know what Part A and Part B is. So now we want to go into what options do you have? Well, option number one is going to be a Medicare supplement plan. A Medicare supplement plan comes in behind Medicare, the Part A and Part B that we just went over, and it covers either some of it or all what's left over from Part A and Part B. These plans are regulated by the federal government, and all companies must offer the same coverage. So if you're looking at one company's Plan F, every company's Plan F is exactly the same. There's no network, so your doctor can't tell you, well, I don't take this company or that company. If they say that, they're referring to the next option we have, Medicare Advantage plans. But with option number one, Medicare supplement plans, there is no network. You can go to any doctor or hospital nationwide that accepts Medicare. It helps cover the gaps in Medicare, Part A and Part B. It does not include your Part D drug coverage. We'll go into drug coverage here in a little bit. Plans are lettered A through N. Now, I hate that they make it confusing, but yes, there are Medicare supplement plans that are lettered A, B, C, D, all the way through to N that have nothing to do with the four parts of Medicare, the Part A and B that we already went over, and the C and D. So it's important to see if there's a Plan B versus a Part B of Medicare. They're not the same thing. So how do you know which supplement plan to choose? Well, on this next page here, I put a little chart together. Maybe do a screenshot if you're at home on your computer, or you can always pause it right here. But these are the three main plans that people choose in 2020. You're going to see there the Plan F, Plan G, and Plan N. Now, I will tell you, if you start Medicare after January 1st, 2020, Plan F is not available for you. Plan F is only available for anybody who started Medicare prior to January 1st, 2020. If you're born after January 1st, 2020, Plan G is going to be most likely the most common plan you see. It covers the most for you. So we can see right there the Part A deductible. Because remember, supplement plans come in and cover after Medicare pays. Well, after Part A is already paid by Medicare, you still have $1,408. So under all three plans, you are covered 100% there. The Part A coinsurance, and you can go back and look, but the Part A coinsurance would be the daily copays of $352 a day and $704 a day. All three plans would cover those at 100%. So under Part A, you would have no kind of copays there. The Part B deductible, that's the medical deductible of $198. Plan F will pay for that $198, so you won't owe it. Under Plan G and N, you would owe that $198 deductible. It's an annual deductible. Once you pay that deductible, then you're okay. Now, the next part there, Part B coinsurance, that's the 20%. Plan F and G will pay that 20%. So under Plan G, the only thing you owe is the $198 deductible. Once you paid that, you're covered at 100%. Plan N says it's a little bit more copays here, but Plan N will say, hey, once you paid your $198 deductible, you cannot pay more than $20 for any kind of office visit, like doctors or specialists, and you can't pay more than $50 for the emergency room. The next part here, Part B excess charges. That's that Mayo Clinic charge I told you about. Well, Plan F is covered 100%. If you go to Mayo Clinic, you will not pay an excess charge. Same thing for Plan G. But Plan N will not cover that excess charge. You would be responsible for that 15% at Mayo Clinic. Skilled nursing care, that's that rehab, inpatient rehab. Medicare already gives you the first 20 days. So this is talking about days 21 through 100. All three plans will cover you up to 100 days for inpatient rehab. I just recently had somebody that spent 35 days in rehab and did not have days 21 through 35 covered. It cost them a lot of money, $170 times whatever, that 14 days there can really add up. So all three plans here will cover that. Preventive care, whatever under Medicare covers for preventive, all three plans covered 100%. Same thing for hospice care, it's covered at 100%. You might hear of other options called a high deductible Plan G or high deductible Plan F. These plans have much lower monthly premiums In exchange, you will have a deductible of $2,340. Once you meet that deductible for the year, it then turns into a regular plan F or G, depends on which one you buy. Okay, so now let's go on to the second option. You cannot do both options. You can't take option number one and option number two. It's one or the other. Option number two is Part C of Medicare, the third part of Medicare, Medicare Advantage plans. These are administered by private insurance companies. They're made up of HMOs and PPOs. An HMO means you need referrals. PPOs, you do not need referrals. And with a PPO, you can go out of network too. But there are networks of doctors and hospitals that you must choose from. Make sure your plan takes it. There's also cost sharing, meaning that a company might say, well, it's $10 to see a primary doctor and $35 or $40 to see a specialist. It's not as comprehensive as option number one, Medicare supplement plan. You do have cost sharing, but they do give extra benefits that Medicare supplement plans do not, like dental, vision, silver sneakers. Actually, I think all the companies now are given some kind of option with these extra benefits here. Also, drug coverage is included in these plans. With the Medicare supplement plan on option number one, they're not allowed to include drug coverage, but these do include drug coverage. And you must have Part A and Part B to sign up. Pretty much either way you go, option one or option two, you're going to have Medicare Part A and Part B. And these plans are offered at zero monthly premium, especially here in Florida. You're not going to pay an additional premium. You pay Medicare, the Part B is $144.60, but you will not pay an additional premium on top of that. Okay, the fourth part of Medicare is Part D, prescription drug coverage. There's two ways to pick up drug coverage. You can either select one of those Medicare Advantage plans, Part C plans that we just talked about, and they include Part D drug coverage. Or you can say, you know what, I don't want to do a Medicare Advantage plan. I'll just take original Medicare, my A and B. I'll pick up a supplement plan that does not include drug coverage, and I'll purchase a separate Part D drug plan. There's a penalty. A lot of people tell me, hey Chaz, you know what, I'm not taking any medications. Do I have to take drug coverage? Well, you don't have to, but there's a penalty for going 63 continuous days without drug coverage. There's a 1% penalty of the national average drug plan premium, and it accrues every month. It's paid forever. I think the national average drug plan premium is about $35, so you can expect about a 35-cent penalty every month you go out without it. So if you go a year without it, you might have about a $4 penalty per month that you will pay forever. And then more years you add on, obviously you can go higher. Now, if you're working and you have coverage through work, you can keep that coverage through work as long as it's creditable, and you will not have a penalty. We'll talk about the employer coverage here in a little bit. Formularies. Every company has a formulary. Don't just choose a company willy-nilly. Make sure they cover your medications. If they're not covered, you might be paying full cost for them. Okay, now we're going to get into, maybe you're still working. I get this, I do seminars locally here in Orlando, and maybe a third of the time somebody's still working or married to somebody who's still working, and they're going to delay Medicare for a little while, and they're worried what to do and if they're going to be penalized. Well, if you're still working and you're covered under group insurance through yourself or through your spouse, you can delay Part B and you will not have any penalties and no loss of coverage. Make sure it's creditable coverage to Medicare. Or you can say, you know what, I've sat with people that their coverage through work is just either too pricey or not really that great coverage. Maybe it has a high deductible or high monthly premium. You can leave that group coverage and go on to Medicare any time of the year. They cannot tell you cannot leave it when you're new to Medicare. If you're starting Medicare, you can pick up Medicare and drop your employer coverage. And you can enroll in a Medicare supplement plan or a Medicare Advantage plan. If you want more info, you can call or text me at 321-287-7331. You can email me at chazmulheron@gmail.com. You can also check my website out, www.mymedicarehotline.com. Again, you never pay for any of my services. If you give me a call or email, I can help you find a plan, explain more about Medicare if you have more questions about it. But I work with every company here in Orlando and actually other states too. So if you have any questions about them or want to run some numbers and see what's available, don't hesitate to give me a call. And thanks for listening today.